Hi everyone, my name is Sheena Crawford, and today we're going to go over the Holistic Health Program Facilitators training. And we're going to review the inspiration for developing the program, a broad overview of steps taken to develop the program, how the program is structured and completed, and then how to facilitate the program. Now, observing healthcare needs. There are many reasons why I chose to develop this program, but I'm just going to go over a few of the inspirations. So, I used to be the director of quality assurance for a mental health and addiction facility, and I received consistent feedback from employees, patients, and the leadership team about various spiritual health regulations or accreditation standards or just preferences, needs. And so the patients would consistently ask about religious literature in the residential programs. And then the employees would consistently ask about whether they were allowed to pray with patients or not because the patients were requesting it. And then I received consistent questions from leadership regarding the spiritual health compliance. At the time, when I requested information from regulatory bodies or accreditation entities, they weren't able to guide us or give us anything concrete on what we should do or how we would handle these situations. And so I knew that we needed to have some type of program that allowed spiritual health to be integrated into treatment, but not required. Also, I realized as I dug into the research and the data that there is a link or correlation between those who have positive beliefs about spiritual health and the effects that it has on their outcomes. Now, the professional challenges that I've seen in my work. Part of my job responsibilities was to ensure quality and evidence-based programs. That was issue number one. There weren't a lot of evidence-based programs that were easy to find and easy to implement in mental health, addiction facilities, and behavioral health facilities, particularly for adults. And also, SAMHSA used to have a directory that had evidence-based programs listed, but it was dismantled in 2018. Now, the SAMHSA directory that was dismantled was a little bit of a hodgepodge. It did include some programs, evidence-based programs, that was proven ineffective. Most people who went to the website may not know that those programs were either proven effective or proven ineffective. A lot of the programs also may not have had a significant amount of research or data backing them. So I expected them to develop another directory that was just improved, but we were just left without anything. And that was another reason why I wanted to create an evidence-based program. Also, most of these programs were quite lengthy, and for a healthcare facility, you typically need reauthorization after approximately 30 days. So any program beyond 30 days would require reauthorization for billing, and you may or may not receive it, and that could disrupt the program's progress with that particular client or that particular patient. So I knew that the program needed to be completed or have the ability to be completed in 30 days or less. I also had an experience with one of my employers where we had a program for women and it was 4 months, but the funders were telling us that we needed to reduce that to 2 months so that we could serve more people in a shorter amount of time. And we had trouble figuring out what we would do with those women as far as a program goes so that they will still receive effective treatment and have good outcomes in a shorter amount of time. So I knew that all of these things needed to be incorporated into an evidence-based program. I knew it needed to be individualized and personalized. I knew it needs to be completed within 30 days or less. It had to have a spiritual health component that was optional. Not everyone has the same beliefs, and so it needed to be an option to opt out. Also, it needed to be supported by adequate research and data and be very flexible in varying environments and for different types of programs like residential programs, outpatient programs, even inpatient programs, detoxification, and so forth. It also needed to be easy to replicate. Can it be that complicated for someone to learn it? And that's why we're doing this training for facilitators. It also needs to be low cost and prevent barriers. A lot of these facilities are nonprofit or they just don't have a significant amount of funding. And it needed to be proven to show effective and positive outcomes. Now, we had many pilots for this program, but I'm going to share with you 3 notable pilots. The first one were the participants who completed the program for 3 weeks. They provided feedback on the program and the holistic health assessment, and that resulted in improvements, including a spiritual health exercise being removed and some of the mental health exercises being reordered. One of the things that were noted about this is that patients or participants felt that this program was too short when it was facilitated at 3 weeks. So for notable pilot number 2, they provided feedback on the program and the assessment again. There were minor improvements this time, but they did suggest adding pictures and quotes and stories and other things that will engage the reader throughout the process. The data was reviewed, and this resulted in changing a few things with the coping mechanism scale with the holistic health assessment. Now, for notable pilot number 3, we decided to try facilitating the program a little bit longer just to see what the results will be. So participants completed this program for 8 weeks. They were also assigned peer support partners. This was based on previous feedback from participants. They had no feedback for improvement on the program or the assessment, but we did notice that attention and engagement and enthusiasm waned after about 1 month. That is one of the reasons why we decided to recommend no more than 4 weeks for facilitation. Someone can complete this for more than 4 weeks, whether it is with a group or a healthcare facility or by themselves. That's completely fine. Just a recommendation based on what we noted from the pilots. Now, wrapping up the pilots, the holistic health program showed 70 to 90% improvement in each domain: coping mechanisms, mental health, physical health, spiritual health, and outlook on life. Outlook on life and mental health had the most improvement. For the holistic health assessment, it showed reliability and validity, with alpha scores at 81% for trauma, 88% for spiritual health, 72% for coping mechanisms, 86% for outlook on life, 89% for mental health, 70% for physical health, and 89% for the full instrument overall. The data and program is consistently evaluated in the community. We try to do that at least every 5 years. So one may be coming up soon, depending on when you watch this facilitation training. Now, why facilitate the program? Every exercise in the workbook has an accompanying presentation. And although someone can complete the program on their own, the presentations add value to the book by going more in depth and offering information from a research perspective. Also, group facilitation allows for peer support, which was one of the aspects that was requested during the pilot. Facilitation also provides an opportunity to ask questions and debrief or process the exercises. And also, discussions completed during facilitation helps with memory and understanding. So although someone can complete this on their own, and it does not require facilitation or even presentations, it does help for these particular aspects. Now, the spiritual health component. We want to allow participants to choose whether spiritual health will be incorporated into their program. If they opt out, that is completely fine. They do not have to complete the spiritual health part of the assessment. It will not affect their scores, and they do not have to complete the spiritual health portion of the program. Now, participants do not need to communicate their choice with the facilitator. They are just simply given the option to stay or leave during the spiritual health portion. Now for stages of change. This is more so for clinical professionals. Sometimes this program may be facilitated in a community, may be facilitated at homeless shelters and churches. If that's the case, then you don't necessarily need to assess for stages of change. But if this is being facilitated in a healthcare facility, then you have an opportunity, and it is best practice to look at the stages of change. Now, as you can see here, stage 2 is contemplation or thinking about changing. And this may be effective still, but it's recommended that they start at stage 3, where they're actually preparing to change. At stage 2, they may just need a resource or need to know what they can do to facilitate that change, and the program may be effective at that point. But definitely at number 1, where someone does not want to change, they don't feel that they need to change, then this would not be a program that would be most effective for them. Also, if someone is dealing with mental health diagnoses that are unstable or significant or severe, like psychosis or schizophrenia, you do want to make sure that they are stabilized before facilitating this program with them. For facilitating the sessions, there is a facilitator's guide online that you can review. It does give you a little bit more steps on how you can facilitate and how you can navigate those discussions during the group sessions. But I'm going to go over a few details during this training. Now, for week 1, when you complete the overview, you do want to have a welcome and a warm up. This helps everyone get comfortable with the facilitator, with the program, with each other, and it allows for introductions. The warm up is similar to an icebreaker. Most people do not like the name icebreaker and they don't like completing icebreakers. But I do have a series of questions that you can choose from that are linked in the guide. And those questions are based on research that has been proven or shown effective for building camaraderie and building relationships with people. And then you want to introduce the program. And at this point, you can just play the overview video, or you can recommend participants watch it. It depends on how much time you have. And then you want to go over any program or location expectations. So tell them what the length of the program is, whether it's 3 weeks, 4 weeks, or even longer. Tell them what the meeting days and times are, and reiterate to them that it's important to respect each other and to hold everything that's shared in confidentiality. Let them know where the restrooms are and all of those types of details. And then you want to have a program discussion. This is the one time that you will complete the exercise with the participants. Exercise 1 allows them to start their detox or their fast as soon as possible. You will want to take turns reading that exercise together and allow them to volunteer reading. And then you want to give them personal time to complete the exercise in the book. Then you want to have a program reminder. Just remind them of their next exercises and to complete the holistic health assessment. For the rest of the weeks, week 2, 3, and 4, you want to have a welcome and a warm up again. Just choose a different question. And then you want to have program expectations briefly. You already went over that in week 1, but you just want to go over it quickly again as a reminder. Then you want to go over the program exercises. This is really quick, just letting them know this was exercise 1, this was exercise 2, and this was exercise 3, and so on and so forth. And then you want to have a program discussion again. In the guide, there are discussions that you can choose from, and you can do some or all. But if you choose to do a different discussion, if you have something else in mind, that's completely okay. And then you want to have an exercise review. So you want to ask participants if there's an exercise that stood out to them or that helped them and why. You want to give them an opportunity to process the exercises that they already completed in their own words. And you want to keep them encouraged, especially when it comes to the detox and fast. And then last, you want to have a program reminder, just again, reminding them of their next exercises. And then helpful tools during facilitation includes name tags, permanent markers for the name tags, obviously the Holistic Health Program book. There is an electronic version of the Holistic Health Program. You can allow the participants to use that. It is recommended to have the physical copy though, so everyone can remain present. If they have the electronic, they're usually on their phone and they can receive text messages and other disruptions while they're completing the program. So, if possible, try to have the physical book. If not possible, the electronic is okay as well. And then you want to have a TV or projector if you're planning on showing any of the presentations. And then you want to have the group expectations posted. That's another reason why you're able to just go through those fairly quickly during the sessions. You also might want to have a whiteboard. Sometimes it helps to see things written down or visualized as you're discussing. And then obviously, if you have a whiteboard, you want to have dry erase markers available. Now, the recommendations for facilitating this program is to schedule the sessions for 1 hour. Usually, if you schedule it for longer, again, attention and enthusiasm can wane unless you have food. And then sometimes there are some participants that are more vocal than others. So you do want to encourage sharing for everyone, and you want to discourage any domination of the conversation. You don't want to call people out or make people feel like they can't share if they're feeling very vocal. You just want to make sure there's some balance and just simply ask, hey, you haven't said anything in a while, or I haven't really heard you speak up. Is there anything that you'd like to share? A lot of times, especially for introverted people, they're just waiting for an opportunity to share. So you have to open that up for them. And then it would be very good for you to complete the holistic health program yourself as a participant. When you complete it, then you know how it works for other participants, and you will know what types of things you might want to change while you facilitate it and move forward with your groups. Now, next steps are to complete the hands-on competency. And by hands-on competency, that means completing the holistic health program as a participant. And then also, there is a competency test. These are optional if you want to be certified as a facilitator. It is recommended to be certified, but not required. I'm excited that you completed the facilitation training, and I hope everything goes well with your groups moving forward. Remember, there is a facilitation guide, so utilize that as well. Have a good day.